Welcome to today's presentation, where we are analyzing a topic that could truly protect your life. Imagine identifying the first signs of prostate cancer before it progresses, giving you an advantage in treatment and a better chance for a healthier life. In the next moments, we are going to reveal 7 essential and early symptoms of prostate cancer that you must recognize. Whether it affects you personally or someone you deeply care about, this knowledge is crucial. As we review these warning signs, always remember that information is power. Early detection can mean the difference between successful treatment and a much harder battle in the future. Before you begin, don't forget to like, subscribe, and comment where you're watching. Remember to subscribe to receive more natural health tips and share your thoughts in the comments. It's always a pleasure to see the reach of our community. Now let's explore these symptoms starting from number 7 and moving toward the most important warning sign at number 1. Each symptom is clearly described along with suggestions on what steps to take if you experience any of these issues. So grab a notebook and stay focused while we guide you through these important early signs that could make a big difference in your health journey. Sign 7. Repeated urinary infections or difficulty urinating. At number 7, one of the first signs you should watch for is having frequent urinary infections or ongoing difficulties when trying to urinate. You may notice that infections come back more often than expected and include discomfort such as burning, urine with an unusual appearance, bad odor, or pressure in the lower abdomen. You may also feel like you need to urinate constantly but have difficulty doing so. This may mean you need to strain to start urination, or that only a slow stream comes out even when the urgency is strong. Although these problems may seem unrelated, especially if they happen from time to time, the fact that they occur over and over can be a subtle message that something is not right with your prostate. Paying attention to how often these changes occur and how intense they are is very important. If these urinary discomforts continue, it is recommended to visit a health professional to identify the real cause and take necessary measures immediately. Sign 6. Reduced or inconsistent urine flow. At number 6, another sign you must keep in mind is a change in how strong and consistent your urine flow is. Many people might ignore a weak stream or occasional interruptions, but when this becomes a habitual pattern, it is a sign that deserves attention. You may notice that urine comes out with less force or that it stops and restarts during urination. This interruption of normal flow can suggest that something is blocking or irritating the urinary system, possibly related to changes in the prostate. Over time, these small differences in how the bladder empties can become more concerning. Measuring things like how long it takes to urinate or how consistent the flow is can provide valuable clues to your doctor. Taking these symptoms seriously and seeking early medical guidance can help detect the problem before it becomes something worse. Sign 5. Increased urgency to urinate, especially at night. At number 5, experiencing a sudden and constant need to urinate is another important sign that should not be ignored, especially when it interrupts your sleep. You may notice that you wake up many times during the night to go to the bathroom, which not only could indicate prostate problems, but also affects your sleep quality and daily energy. This nighttime urgency is easier to detect because it interferes with your rest hours and can make you feel tired the next day. Besides altering your nights, the continued urgency to urinate can create other difficulties such as dehydration or discomfort during the day. It is essential to observe whether this increase in urgency appears along with other symptoms such as pain, discomfort, or an unusual color change in urine. Writing down these details can provide more precise information to your health professional, helping with quick detection and timely treatment that may be key to maintaining good health. Sign 4. Blood in urine or semen. Ranked at number 4, the presence of blood in urine or semen is a serious sign that must never be ignored. This problem may appear as pink, reddish, or even dark brown urine, or as unexpected traces of blood during ejaculation. Although many conditions can cause this, including infections or kidney stones, when this symptom appears along with other prostate-related issues, it becomes an important warning sign. It is essential to understand that the presence of blood indicates that there might be an underlying problem related to the prostate or nearby tissues. It could be due to irritation, infection, or, in more concerning situations, early stages of prostate cancer. Even if it happens sporadically, it deserves immediate medical attention from a professional who can perform the appropriate tests to determine the cause. Carefully observing how often it occurs and whether it comes with pain or discomfort can greatly help in early detection and treatment. Remember, addressing these signs as soon as possible can protect your health and lead to better long-term outcomes. Sign 3. Pain or discomfort in the lower back, hips, or pelvis. At number 3, constant pain or discomfort in the lower back, hips, or pelvic area may indicate a potentially serious problem. It's not just occasional discomfort, it's a persistent pain that does not go away and may sometimes intensify over time. This discomfort may appear as a dull and continuous pain or as sharper sensations that interrupt daily activities. Many men assume this pain is simply due to aging or physical strain, but when it is constant or appears along with symptoms such as difficulty urinating or changes in urinary flow, it should be considered as a possible early sign of a prostate disorder. Because the prostate is located near these areas, inflammation or abnormal growth can cause pain in nearby regions. Recording when the pain occurs, how long it lasts, and what situations make it worse can provide essential information to your doctor. Recognizing these patterns early allows for proper evaluation and ensures that any underlying problem receives fast and effective care. Sign 2. Erectile dysfunction. At number 2, erectile dysfunction, ED, can act as an important indicator related to changes in prostate health. Although ED is common and can originate from many causes, when it appears along with urinary or pelvic symptoms, it may indicate that something is affecting the prostate. This condition not only relates to sexual performance, it can also reflect changes in blood circulation, nerve function, or hormonal balance caused by prostate inflammation or enlargement. You may find it harder to achieve or maintain an erection, or notice a decrease in its firmness, which can create worry or frustration. It is essential to understand that the body sometimes sends health warnings through changes in sexual function. If you notice sudden difficulties or a gradual worsening of the problem, openly speaking with a medical professional is essential. A complete evaluation, including diagnostic tests, can help determine whether the prostate is involved or if there is another cause affecting these symptoms. Sign 1. Pelvic pain or unexplained discomfort. Finally, the number 1 sign you must take into account is unexplained pain or discomfort in the pelvic area. This type of pain tends to be persistent. That means it does not go away with rest or common medications, and it may interfere with daily routines. The discomfort may feel like constant pressure or like a sharp pain, and it may extend to the lower back, hips, or upper thighs. Because the prostate is located deep in the pelvic region, any structural change, whether caused by inflammation, enlargement, or other abnormalities, can generate pain that is noticeable from early stages. This symptom is especially alarming because it may be the first sign before urinary or sexual changes appear. The pain may begin mildly and seem insignificant, or be confused with a muscle strain, but its persistence is something that should not be underestimated. Recording the duration, intensity, and triggers of the pain can be very helpful in obtaining an accurate diagnosis. Recognizing this warning sign early can lead to faster medical attention and significantly improve future health outcomes. Thank you for watching and learning about these important early signs of prostate cancer. Our goal is to help you stay informed so you can seek professional attention when something doesn't feel normal. Early detection offers the best chance of having more treatment options and better overall health. If this information helped you or someone you appreciate, please support our channel by giving the video a like, subscribing for more health tips, and sharing this content with others who could benefit. Your participation allows us to reach more people with information that can save lives. Take a moment to reflect on what you have learned and feel free to share your thoughts or experiences in the comments. Staying alert and acting on time is one of the most important steps toward a healthier future. Until next time, stay alert, take care of yourself, and remember, your health is your most valuable resource.